Hi, this is Jerome Fryer. I just wanted to share with you a condition called stenosis and what it actually means and what it means to the patient, what it means to the clinician in explaining symptoms related to stenosis. Stenosis is a narrowing of the spinal canal, which is this canal right here. This is the canal and this is the cauda equina that is represented with this model, this dynamic model of L3, L4, L5, and S1. So what happens with stenosis? Very often there's a narrowing of the disc height. And when there's a narrowing of the disc height, when the disc height is compressed, the facets approximate. You can see how they slide together. So there's compression, disc height loss, often as a result of disruption to the annular structures and the nucleus within the disc, which I'll share with you in a moment here. But when there's disc height loss, that causes most often, this is the main cause of facet arthropathy or facet arthritis. So this structure starts to rub or approximate. And there's a term called denuded, which means stripping of the cartilage, and that causes a reactive response to build little osteophytes. So here's another example here. You can see this is what I was talking about, disc disruption. So this is the same segment out of this model, this multi-level model, but this is a one-level model. You can see that disc disruption starts from the inside, and what happens, there's annular tears and the disc height comes down, and there's facet encroachment, and then these structures start to overproduce hydroxyapatite, and that causes facet arthrosis. So here's the spinal canal, and if you pull this out, you can actually see how large the canal is. So it's actually got lots of room, right, with good disc height. Now, what happens is this is a different model altogether, casted from a degenerative specimen. You can see the facets, how they become arthritic and they start to spur off. And what that does is it causes narrowing of the spinal canal. There's a couple other things that can cause stenosis, which is the ligamentum flavum, which is a structure right in here that goes between the lamina. This actually folds onto itself and encroaches the spinal canal. You can see how much more narrow that spinal canal is compared to this one, for example. And if you take those side by side, this is a model that has been created with a side-by-side comparison where we have a much more open canal on this side and a much more narrow canal on this side. And you can see deep within the nucleus how the core, which is the nucleus, will actually move under different vector loads. Most often patients will present with pain related to prolonged walking. And what that means is when you walk, the spine is more in extension. Okay, there's more extension or standing upright. So these facets slide together. And if you look carefully, extension will actually narrow. See how it narrows the canal a little bit? So when you walk for a period of time, it causes even more narrowing. And then the patient explains that they have to sit down. And when you sit down, that causes the spine to actually, you can see how the canal will open up even further. See how the canal opens up? Let's see, there we go right there. See that? So under flexion, when you sit, there's a period of relief. So stenosis is a narrowing of the spinal canal most often due to facet arthropathy because of disc height loss. So when you're developing strategies to improve this condition, flexion is always, or bending forward is always something that you want to consider to open up the spinal canal, to help reduce the buckling of that ligamentum flavum, but most importantly, try to improve the hydraulic height of the intervertebral disc. A very easy way to explain to patients about the narrowing of the canal and extension is you take a pen, place it in the spinal canal, and you can see extension will actually stiffen up and create more friction, but as soon as you take it into flexion, the pen drops.